Hi, I'm Cara Hanson. I'm Professor of Health System Economics at the London School of Hygiene and Tropical Medicine. I'm Associate Dean for Research in the Faculty of Public Health and Policy. And in my research life, I am co-director of RESYST, which is a DFID-funded research consortium that aims to generate evidence that will help health systems to become more resilient and more responsive. So RESYST is this consortium made up of country-level health systems researchers in 10 different settings in Africa and Asia. We focus our work on health system financing, on the health workforce, and on health system governance and accountability. I've been most involved in the research on health financing, and there we've had two main questions. One is, how do we generate more resources for health and do this in an equitable way? And the second is, how do we use those resources? And in particular, looking at the function of purchasing, which is the health financing function through which resources are channeled from pooled funds through to healthcare providers. So we've conceptualized purchasing as having to do with three main questions. The first is what services should be offered, and that should be determined on the basis of cost effectiveness, of affordability and budget impact, and also of equity. The second question is who should provide these services, and that could be from entirely public healthcare providers or from a mix of public and private providers. And the third question is how should these services be purchased, and that really deals with the nature of the contracts and the payment mechanisms and the other policy levers that the purchasers can exert to help healthcare providers do their jobs with high levels of equity and quality and efficiency. We've explored purchasing through a large study of country-level purchasing arrangements. So we've looked in 10 different countries at 19 different purchasing arrangements. And here we sought to characterize these in terms of the relationship between the purchaser and three key other bodies. One is government, that has oversight over the purchaser's activities and has responsibility for setting the overall policy framework. The second is with providers, and that's where purchasers use their contracting and payment terms to influence provider behavior. And then the third is their responsibility to citizens or patients. And there, that's about making sure that the services that are delivered meet the expectations of patients, that they have good understanding and knowledge of how to access their entitlements, but also that there are mechanisms in place for them to voice any concerns or disgruntlement with the way that services are provided, and that this information can be used, channeled through the system to make effective change. Through this research, we identified a number of interesting things. One was that policy frameworks around purchasing are really incomplete. In most places, purchasing is just not seen as an integrated function. So countries will work on benefit package design, or they'll work on provider payment design, but very rarely is the purchasing function seen together as encompassing all three of those choices of what services, what providers, and how services are purchased. We did see some, we also looked at implementation gaps. So even where policies are in place, it's not at all uncommon to find that they're not being implemented as expected. We did find some examples of really good purchasing practice. So in Thailand, for example, the National Health Security Office that's responsible for purchasing for the Universal Coverage Scheme was a great example of best practice. They have a really purposive approach to establishing the benefit package. They use provider payment mechanisms that really encourage providers to be efficient with their resources. They also use their purchasing power to procure drugs and supplies at good prices and generate savings for the system as a whole. And they have strong structures of accountability to both to patients, but also to the system as a whole through their governance structures. So there's been a lot of interest in our purchasing work. At the country level, the South African government and the Kenyan government have both been adopting the idea of strategic purchasing as a way of really influencing healthcare providers within their systems. At the global level, there have also been initiatives to help identify how countries can be supported to increase the strategicness of their purchasing, both from the World Health Organization and from the Gates Foundation. My colleague Ayako Honda from the University of Cape Town will be presenting her work on how countries have used quality enhancement mechanisms within strategic purchasing here at IHEA on Tuesday morning at 8 o'clock.